I just want to know, do you share the Prime Minister's confidence with these latest figures for vaccinations in care homes?
So I think it is very positive, and it's a major achievement that we have rolled out vaccinations across care homes nationwide. However, our data suggests that there is a potential and emerging vaccination blind spot. At Cera, we look after 10,000 older people a day in their own homes, and just 1% of these older people have been vaccinated thus far. And we believe that's because, on the one hand, there are individuals in care homes who are being vaccinated at their place of residence, and that's rightly so. On the other hand, there are older people in their own homes who are healthy enough to travel to a vaccination centre, but there is a group in the middle of older, frail, isolated, vulnerable older people who are receiving care at home and unfortunately cannot travel to a vaccination centre or are too anxious to do so. And that is potentially a group of 1 million people. And we're concerned that unless change is taken, there could be a forgotten million who are left behind and not vaccinated. And of course, we need a vaccination rollout programme that addresses inequalities rather than potentially exacerbating them.
Ben, just to be slightly more optimistic about that, we're talking about people, presumably, if they're at home, they're not going out, they're less at risk.
They are potentially less at risk, but of course, after lockdown eases up, potentially individuals may be visiting these older people. Occasionally, they may have support going into the community, to parks, to grocery stores and so on. And these individuals, just like those in care homes, have the right to be vaccinated. And just because they're unable to travel to a vaccination centre doesn't mean we shouldn't be catering for them. If you look at other countries across Europe, parts of Asia, even North America, they have adopted mobile vaccination units that go out and visit people in their own homes, vaccinating them there if they aren't able to travel to a centre themselves. And I think it's really important our country considers a similar intervention and line of action so that we can step up and look after this group of around 1 million or so of our oldest and most vulnerable in society.
The call's already for mobile units. I mean, how would that work? And how many are you going to need?
We're already seeing on the margins that community nurses are trying to provide small numbers of vaccinations to the most vulnerable individuals and those who are housebound. Trying to do that in a more coordinated, national and at-scale manner, I think, is what we're looking for. And countries such as Turkey, Bahrain, parts of Sweden are already doing this. So I definitely think it's within the realms of possibility. We've made amazing progress when it comes to care homes, but it's now time that we offer a similar level of effort and rollout and reach to those who are most vulnerable in their own homes. And of course, I mean, we learned the hard way from the first wave that if we do forget about older people, very sadly, there have been thousands, if not tens of thousands of tragedies. And we can't afford to let something like that happen again.
Ben, are you really saying that the government has forgotten these 1 million people?
I think that these are individuals who've slipped through the cracks. I think the government has its priority groups, but it could better prioritise this group of individuals who are older and vulnerable in their own homes, who actually are in the groups that are meant to be prioritised.
Ben Maruthappu, it's really good to talk to you. Thank you very much for your time this afternoon. Thanks. Well,